Let's talk about Alzheimer's disease, how it affects the brain, and how it creates changes in behavior as it progresses. Alzheimer's is, at this point, an incurable neurological disease. It's thought to be caused by a buildup of protein clusters and fibers that destroy nerve cells in the brain. Neurofibrillary tangles are web-like fibers of a protein called tau. They form within the brain cells and destroy them by cutting off nutrients. Beta amyloid plaques grow outside brain cells. These proteins block off cell-to-cell signaling and trigger inflammation and cell destruction. Brain chemistry is affected as well with Alzheimer's. Acetylcholine, a chemical necessary for memory, begins to diminish. And, as nerve cells die, affected regions of the brain begin to shrink. As more and more neurons are destroyed, the whole brain itself begins to shrink. These changes to the brain can start to occur decades before symptoms become evident. When you think of Alzheimer's, you might think of memory loss. But for some people, the first symptoms may be much subtler than that, at first seeming like normal everyday disruptions or frustrations. As Alzheimer's disease progresses through its stages, the symptoms change too, but not distinctly so. With mild Alzheimer's disease, signs may include mild short-term memory loss, trouble with finding words, especially nouns and names of things, confusion, trouble handling money, poor judgment, mood changes, and anxiety. Moderate Alzheimer's disease symptoms may include increased memory loss and confusion, problems recognizing people, difficulty with language and thoughts, restlessness and agitation, sleep disturbance, wandering and getting lost, making repetitive statements such as repeating stories and questions, and having trouble with dressing, bathing, and other activities of daily living. With severe Alzheimer's disease, extreme shrinkage occurs in the brain, and patients are completely dependent on others for care. Symptoms here may include trouble swallowing, weight loss, seizures, skin infections, limited language, moaning, groaning, or grunting, increased sleeping, and loss of bladder and bowel control. Caregivers may turn to hospice for help and use palliative care at this stage, as death usually occurs from pneumonia or other infections. Just because someone has Alzheimer's doesn't mean there aren't other illnesses such as heart disease or cancer that could be affecting them. People don't necessarily die of Alzheimer's. They are likely to get pneumonia or another illness before reaching the final stages of the disease. It's important to remember that Alzheimer's disease cannot be completely defined by its stages. Symptoms vary from person to person and from situation to situation. For example, symptoms may worsen in an unfamiliar environment, or people can rise to the occasion and act fine at the doctor's office or when company comes. Symptoms and behaviors are not predictable and sometimes change from day to day. For example, a person's ability to tie their shoes may vary from day to day as the person basically unlearns the task. Generally, there are two types of Alzheimer's disease: sporadic and familial. Sporadic Alzheimer's is the most common type. About 95% of those diagnosed with the disease have it. The greatest risk factor is increasing age. It affects nearly 50% of people aged 85 or older. Family history, such as an increased risk due to the ApoE4 gene, and people with Down syndrome have a higher risk for this type of the disease. Lifestyle, Serious head injuries and other illnesses such as diabetes are risk factors as well. The other type of Alzheimer's disease is called familial, or early onset Alzheimer's. It is rare and usually genetic, and generally affects people from 30 to 60 years old. As both types of Alzheimer's progress, the disease starts to control the person's personality, mood, and abilities, what the person does and says, essentially who the person is. These changes will most likely be difficult for you and the person you care for. However, researchers are continuing to work on developing treatments for Alzheimer's disease and ways to prevent it. New findings are coming out every day.